But we'll move on now to our last speaker this afternoon, who is Dr. Daniel Sokol. Daniel is well known to the UK medical fraternity for the clarity and wisdom of his discussions on a variety of topics within medical ethics. These appeared as regular columns in the British Medical Journal, and I think have done a lot to educate people in the principles of medical ethics and certainly stimulate interest in the topic and also ethical debate amongst doctors. He no longer does a regular column, but fortunately, the previous one's been collected in a book entitled Tough Choices, Stories from the Front Line of Medical Ethics, so that if you like what you hear from him shortly, you can read more from him from the book. Following an academic career in ethics, he retrained as a lawyer with expertise in medical law. He's also, as well as practicing the law, he gives his advice to various committees, the Ministry of Defence, Ministry of Justice, and the Royal College of Surgeons on medical ethical problems. So without further ado, I will ask Dr. Daniel Sokol to talk to us about Sir William Osler and medical ethics. Thank you, Daniel.
Hello, thank you for the invitation and thank you for watching. It's a pleasure to be here to share some thoughts about William Osler and medical ethics. I'm a medical ethicist and a lawyer specializing in clinical negligence. And I want to tell you about a recent client of mine, whom I shall call Mr. T. Mr. T has very kindly given permission to talk about his case today. And I also want to thank Daniel Thomas, my instructing solicitor from New Law Solicitors, who worked tirelessly on this case. When I first came across Mr. T a few years ago, he was 62. He lived alone and suffered from depression. He'd lived a life of utter misery, plagued by an abusive father, homelessness, alcoholism, long-term unemployment, relationship and behavioral problems, anxiety and depression. A few months before we met, Mr. T had asked for his medical records as part of an application to move into a new council flat. And as he went through his records, he found a letter dated the 20th of August, 1968. He was 13 at the time of that letter. And the letter was written by a surgical registrar and addressed to his GP. And it read as follows. Dear Doctor, this is a very curious state of affairs. Mr. X, the consultant surgeon, thought this lad looked a bit odd when he came in for his bilateral orchidopexy, and we arranged for him to have a buccal smear. Shortly after the operation, we were informed that he is in fact a nuclear female, probably a Klinefelter, though this is by no means confirmed yet. We had a discussion about this, and I would have thought it probably best to say nothing to the parents or the patient at this stage, as it could only lead to needless worry about an untreatable condition. When Mr. T read this, he had never heard of Klinefelters, but wondered whether this could explain why his body had no hair. He had never gone through puberty. Why he had breasts and feminine features. Why he had a micropenis. Why he was picked on at school and beaten by his father, who forced him to take up boxing to man up. Is this why he suffered all his adult life from emotional and psychological problems? So Mr. T went to his GP with the letter and soon after was diagnosed with Klinefelter syndrome, which is a genetic condition in which a man is born with an extra X chromosome. the main treatment is testosterone replacement therapy. This was also the treatment in 1968, contrary to what the surgeon told the GP in the letter. Over the next 50 years, Mr. T visited his GP practice about 350 times with all sorts of complaints, from palpitations to anxiety. And several doctors referred explicitly to the suspected Klinefelters in their notes, but not a single one told him about this. No one referred him to an endocrinologist or a geneticist. So, for example, in 1968, his exasperated GP referred him to a psychiatrist to look into the behavioral problems and wrote this in the referral letter. It is totally impossible to make head or tail of his symptoms, which are obviously aggravated by anxiety and depression, if not caused by them. The only clue I have to this awful mess is that in 1968, he was found to be probably Klinefelters. Do you think this is the underlying problem? Last year, Mr. T started on hormone replacement therapy, and he is a completely changed man. The effectiveness of the treatment in his 60s strongly suggests that it would also have been highly effective in his teenage years. Now, Osler wouldn't have known about Klinefelters, which was only characterized and understood in the 1950s. But Osler's writings do have something to say about this case, about this story. As part of my preparation for this lecture, I read and reread many of Osler's essays. One dominant theme in his writing is the importance for doctors of the head and the heart. So, for example, in The Army Surgeon, talks of medicine as an art engaging equally heart and head. In Teaching and Thinking, 1895, the physician needs a clear head and a kind heart. His work is arduous and complex, requiring the exercise of the very highest faculties of the mind, while constantly appealing to the emotions and finer feelings. And in The Master Word in Medicine, 1903, the practice of medicine is an art, not a trade, a calling, not a business, a calling in which your heart will be exercised equally with your head. Ethicists have tended to focus on the importance of the heart, of compassion and kindness. In Mr. T's case, the surgeon in 1968 had his heart in the right place, since he didn't want to cause the patient or his parents needless worry about an untreatable condition. But the surgeon made a dreadful mistake of the head. He mistakenly informed the GP that there was no treatment for Klinefelters. There was, and there is little doubt that Mr. T's life would have been radically different had he been treated back then. In Teacher and Student, 1892, Osler wrote of the importance of the quality of thoroughness. He says, "It means such a knowledge of diseases and of the emergencies of life and of the means for their alleviation that you are safe and trustworthy guides for your fellow men." Now, that doesn't mean, of course, that a general surgeon should know about Klinefelter syndrome, but that he or she should either look things up or follow Osler's advice when he said, "I have learned since to be a better student and to be ready to say to my fellow students, I do not know." The surgical registrar in 1968 could have just told the GP that he doesn't know about the management of Klinefelters, and that would have led the GP to refer Mr. T to a specialist. Instead, the registrar on this occasion failed to be a safe and trustworthy guide to his GP colleague, with tragic, lifelong consequences for his patient. A big clue about Osler's ethics lies in his admiration of the Hippocratic Oath. In Chauvinism in Medicine, 1902, he writes of the high moral ideals expressed in that most memorable of human documents, the Hippocratic Oath. And in an unpublished lecture in 1910, The Lessons of Greek Medicine, he called the oath the credo of the profession. In my role as an ethicist, I deliver one-to-one ethics training to doctors who have been accused or found guilty of misconduct by their employer or their regulatory body. And whatever they did wrong, whether it's a mistake of the head or the heart, I always start the course by looking at the Hippocratic Oath, which is only about 400 words long, but in my view contains the essence of medical ethics. One passage in the oath says this: "I will not cut persons labouring under the stone, but will leave this to be done by men who are practitioners of this work." Now, my interpretation of this is that doctors should know the limits of their competence and refer to suitable colleagues when something falls outside their limits. Only then can they truly benefit the ill and keep them from harm, which are other instructions in the oath. Interestingly, in the case of Mr. T, it's not the medic who needs to refer the patient to the surgeon, but the surgeon who needs to refer to the medic. So the modern version of the Hippocratic Oath might be something like this: "I will not make recommendations about treatments for conditions outside my field of expertise, but will leave this to be done by men or women who are practitioners in that field." In going back to Mr. T, in the 1970s, 80s, 90s, and 2000s, Mr. T's doctors had opportunities to tell him about the suspected diagnosis made in 1968. Several of them had spotted the letter from the surgical registrar of 1968. Yet none of them said anything to Mr. T. And I've asked myself, and others, why they withheld this from him. And part of the answer must be that the doctors were reluctant to open the proverbial can of worms, especially in a short 10-minute or so consultation. After all, they might have received a complaint or even got sued by the patient. It was much easier to maintain the status quo. And there are two helpful lessons from Osler here. The first is his emphasis on the golden rule. So again, in Chauvinism in Medicine, he wrote, "The golden rule is not always as it should be, our code of ethics." And in Nurse and Patient, 1897, "In some of us, the ceaseless panorama of suffering tends to dull that fine edge of sympathy with which we started. We, physicians and nurses, have but one enduring corrective: the practice towards patients of the golden rule of humanity as announced by Confucius. What you do not like when done to yourself, do not do to others." I suspect most of us, if we applied the golden rule to Mr. T's situation, would have wanted to know the truth, or at least been given the option of knowing the truth. Now, an awareness of the golden rule doesn't mean that people will actually apply it, especially if that could lead to an awkward or unpleasant situation. And this is where the second lesson from Osler comes in. The second lesson is the importance of moral courage, so prevalent in Equanimitas in 1889. Referring to the cares and anxieties incident to professional life, Osler wrote, "Stand up bravely, even against the worst." And he continues, "If the fight is for principle and justice, even when failure seems certain, when many have failed before, cling to your ideal, and like Childe Roland before the Dark Tower, set the slug horn to your lips, blow the challenge, and calmly await the conflict." It's not enough to think ethically, to have virtuous thoughts, but you must also act ethically and at times this will require a great deal of courage. I suspect that some of Mr. T's doctors knew that giving Mr. T the option of knowing the truth about his condition was the morally right course of action. Nevertheless, for whatever reason, they failed to act on this knowledge. In his book, Disrupted Dialogue, the respected American bioethicist Robert Veitch dismissed Osler's philosophy as pop philosophy. And more recently, Fides and Komisarov have called for a reappraisal of Osler's legacy, criticizing Osler for, among other things, avoiding the debates concerning medical ethics. My response is that Osler never claimed to be a philosopher. In fact, quite the opposite. In the long essay Science and Immortality, 1904, he wrote, "Neither a philosopher nor the son of a philosopher, I missed the lofty vantage ground of a prolonged training in things of the spirit enjoyed by my predecessors in this lectureship." Osler certainly did not avoid discussing the ethics of his profession, even though he rarely used the word ethics in his writings. In fact, I would argue that a significant part of his work is about ethics, about the fundamentally moral nature of medicine, about that special bond between doctor and patient and between doctors themselves, about the importance of a doctor's character, about moral ideals, the virtues of the head and the heart, such as wisdom and patience and coolness of nerve and courage in the face of injustice and respect for patients and colleagues, humility, kindness, and good judgment. These lessons about being a doctor and the practice of medicine, like so many of the classical texts that he uses in his writings, transcend time. And surely that is why, 100 years on from his death, we still write and talk about Osler and still apply his advice to contemporary cases like that of Mr. T. When I last saw Mr. T, he had a beard. It was the first time in his life that he had been able to grow facial hair, and he was also in a happy relationship. And a few months ago, Daniel and I obtained a large settlement in compensation for Mr. T's losses over the last 50 years or so. So I've come to the end of my lecture. If you would like to know more about Mr. T's case, I wrote a relatively detailed piece on Medscape with a commentary from the expert endocrinologist, Dr. Darzi, and it's available at no charge on this link here. And I've also included a reference to an excellent book on the Hippocratic Oath by the physician ethicist Dr. Stephen Miles, which is here. You can see it's quite short, but it really is a very good book. So thank you very much for watching. And if you want to contact me for any reason, then this is my email address. And if you want to follow me on Twitter, this is my Twitter handle. Thank you very much.